Good afternoon. Today is May 19th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that a new study published on last Wednesday in the Proceedings of the National Academy of Sciences could help explain how people with mild or no symptoms can transmit the virus through talking. So the coronavirus transmits from person to person, but inside tiny respiratory droplets, and these droplets tend to fall on the ground or stay in the air where people can touch them and transfer them to their faces, or they can inhale them. So elaborate experiments have been done to see how many droplets can be transmitted from a person that is sick, and the National Institute of Diabetes and Digestive and Kidney Diseases and the University of Pennsylvania asked volunteers to repeat the words "stay healthy" several times. And the research found that 2,600 small droplets were produced per second while talking. And the amount of droplets also vary from the words that are spoken, such as the th sound is more can transmit the virus than other sounds. So, although scientists did not record speak droplets produced by the people who are sick, previous studies have shown that a single minute of loud speaking could generate at least 1,000 virus-containing droplets. So this is just the end. They also found that as soon as the droplets leave a person's mouth, they can still float in the air for 8 to 14 minutes. And I think this study just shows how there is a substantial probability that normal speaking can cause airborne virus transmission in confined environments. So I think this just shows the importance of practicing social distancing by staying 6 feet away from people. And while there's a lot of factors that need to be weighed in, I feel like it's still really important that even if you're outside or indoors, please practice social distancing, because if even talking can transmit the virus, then other things can definitely do as well. The second thing that I'd like to talk about is the risks of staying outdoors. So obviously, after the talk about spreading the virus through talking, I think that staying outdoors would definitely be safer than indoors, because there's wind and that can just stop the virus from transmitting. However, I feel like you should always practice social distancing and wear a mask if that is not possible, because even though the risk of contracting the virus outdoors is extremely slim, there is, after all, still a risk, especially in places like beaches where people stay at the same place for a long time. I feel like it may potentially get very dangerous and you may contract the virus in that way too. Experts have also said that few cases have been seen from outdoor transmission, and I feel like for many Americans that are basically trapped at home, going outdoors may be a good idea, but do take precautions and if you're gathering, keep gatherings small. The third thing that I'd like to talk about is that many virus outbreaks have emerged in food facilities such as bakeries, farms, and packing houses. So previously, a few weeks before, I talked about meat packing plants across the country which are contracting the virus, but now we have seen more outbreaks in food facilities in the same manner how the virus is spread through meat processing factories. Workers must stand close together to do their jobs, and also crowd into locker rooms and cafeteria. Some of the major clusters include a mushroom farm in Tennessee, in vegetable processing facilities, and a Abbey Mart Foods bakery has at least 52 cases. And I think the very important thing is that workers and employees is that they have not been offered neither testing nor ample personal protection equipment or PPE, and that they have faced recommendations from employers when they complain. So officials at companies say that they do not have any COVID-19 cases and had provided masks and gloves as equipment become available. However, I feel like we need to protect everyone, so companies should provide testing, and after all, if they're not going to do anything and the workers fall sick, then they're not going to have a workforce, and that's going to be a worse outcome. That's it. Thank you for listening, and I hope you have a good day. Thank you.